and gentlemen, welcome to Global Health. This is your host, Dr. Yavuz Selim Sılay, physician, entrepreneur, and venture architect. I'm really thrilled and excited to bring you people from all walks of life who are touching the global health around the globe. These amazing leaders are making difference in communities across Africa. And today, I have a phenomenal plastic surgeon. Very proud to call him my dear friend, Prof.Dr. Furkan Karabekmez. He is one of the top leaders at the global level and really taking care of amazing, also difficult procedures in plastic surgery. We'll be having very special discussions with him. Welcome, Professor Dr. Furkan Karabekmez. We're so excited to have you. How are you today?
Thank you very much. Thank you very much. It's a great pleasure to you, with a guest in your program.
Thank you.
And I'm thrilled to come here.
We're honored to have you. I know how busy you are, and I'm really grateful for being with us.
Thank you.
You're very special for us. The way you're taking care of your patients. You're very popular in different areas of surgery. And on behalf of NTR TV, we are grateful for being with us today.
Very nice to meet you again.
Thank you. I know you very well, but for our all our viewers across the globe, can you tell a little bit about yourself? Who is Dr. Furkan? What excites him? What motivates him? It will be very nice to have them get to know you.
Yes, I graduated from medical school, Istanbul University Medical School, 1999. It's one of the best schools in medical schools in Turkey, just like the Ankara University Medical School, your university.
Thank you.
And after that, I used to work in the emergency department, ambulance, for 1 year or 2 years. And after that, I spent some time in the University in the histology department.
Nice.
And after that, I started my plastic surgery training in Selçuk University Hospital. It takes
in
Konya.
Yes.
It takes about 7.5 years. It's a very, very long.
Very long training.
Yeah, inside our training, I have some scheduled in the general surgery, ENT, and in all departments, almost all departments in surgical departments. And at the end of this training, I have the opportunity to visit in the United States, Mayo Clinic.
I remember when I was in the States, you came to Mayo. You were in Rochester, right?
In Rochester, Minnesota.
Yes.
It's a very prestigious hospital, and they have a lot of guests from all over the world. And I spent about 2 years in that hospital. And during that time, I worked in the plastic surgery departments, oral maxillofacial surgery departments, and also worked some time in the research. I produced a lot of scientific papers in both clinical and experimental.
You're very productive, I know that, and I'm sure both on the clinical as well as research side, you have done a lot in the United States.
I joined a lot of surgery, and I learned a lot of things. And Steve Moran, one of the best surgeons in plastic surgery, he was the head of the department. He helped me a lot, and also Dr. Keller in the oral maxillofacial surgery.
We say hi to Dr. Keller from here.
Yes, we would say hi to Dr. Keller. And after this visit, I had good connection with all doctors. And after, I guess 1 year later or 2 years later, I invited some of them as a host in Konya Selçuk University. And with my mentors, Dr. Nedim and Dr. Zekiye, we invited them. I guess 6 doctors from Mayo Clinic came to Turkey, Istanbul and Konya. We invited maybe more than 50 doctors in Turkey. And we have a good meeting. I was the secretary of the meeting. It's very productive. It's very nice to make a connection with international connections. Hopefully, we will get a connection with the African countries with this.
We would love to do this
with your help.
Together with this program, as well as you're very well known. From Saudi Arabia to Qatar to Dubai to all patients. They know you very well. I know they're lined up for many years. But I'm very curious from your perspective. In your clinic, what type of surgeries do you usually perform for our viewers?
It's changing with time to time, but generally I have both in cosmetic surgical patients and also reconstructive patients. And in the reconstructive part, we had some patients with tumors and patients with congenital anomalies like cleft lip, cleft palate. And also these patients, they have a lot of surgery during their lifetime. They are connected with us. And even though I changed my cities, they follow me and then come find me. I did a lot of surgery with these patients. And the aesthetic part, generally the rhinoplasty and the face aesthetic surgical procedures, and also the body surgery for augmentation and reductionoplasty. And after, in Turkey, we have a lot of patients with bariatric surgery patient, which means the patient lost a lot of weight and has excess skin over the body, and we remove this excess skin like a tailor.
And to make it cosmetic and
cosmetic.
feel also
and
better.
also functional effect.
As well. I see.
This is the most of my practice.
Pretty much, you do all types of surgeries, from birth defects to rhinoplasty to all different types. You're very selective, I know. But in terms of the procedures, which are the most popular procedures in aesthetic surgery in your clinic?
In our clinic, I guess the blepharoplasty, the eye surgery.
Eye surgery.
This
blepharoplasty.
This is excess skin over the upper
so
skin.
This upper lid, you're taking it?
Yeah, this is a local anesthesia procedure. That's why many patients come. Maybe sometimes one day 3 patients get the same surgery. They about 1 hour they finish and go with walking without anesthesia. That's why it's.
This is one of the most frequent ones, blepharoplasty.
Yeah.
So, do they feel uncomfortable, or does it impair their function, or how does it, the upper eyelid
actually,
impact actually?
It's improved the function because most of them they decrease the sight because the excess skin close the sight.
It's harder for them to open maybe.
They generally try to improve their sight with elevating their eyebrows. And it's very heavy. After one day they feel very fatigued or tired because of this movement all day, and they have some wrinkles in here. Once I remove the excess skin, they feel, oh, I can see everything without any movement of face.
This is amazing.
That's why...
it has also other effects, because you're removing, it also impacts the wrinkles here as well.
No need to make the wrinkles, because you can see without higher eyebrows. And the second one, I guess, rhinoplasty, the second one, because many patients have some trauma in the nose. That's why they have some deviation or some hump, some cosmetic. Or
they have difficulty breathing or snoring at night.
They both functional and cosmetic problem with the nose. Since the growing center of the nose is the septum. The septum is the wall between the 2 holes. And when you hit during your childhood, during the development time, it's make deviation inside. You can have some snoring problem, or when you walk or run, you cannot breathe through your nose. And they need sometimes some have some difficulty of, they have headache because the deviation close the sinus during the evening. That's why they need, some people know, some don't know. They said, oh, I have deviation. And during this deviation correction, most of them ask some change in the appearance also.
Of course.
We combine the functional and cosmetic surgery together.
So you're actually improving their life significantly. If they have headache or other difficulties or difficulty taking enough oxygen, you're helping them to have a better quality of life, and also aesthetically have a better
it's help to self-esteem.
I see. It impacts the self-esteem, right? They feel better when they get back to their lives. And how long does the recovery take for the rhinoplasty, since it's also one of the most frequent after blepharoplasty? Like, how long is the procedure? What are the risks involved? And usually, how many days does it take to recover?
Generally, the rhinoplasty itself mean 2.5 hours takes time for septoplasty and rhinoplasty together. Are
you breaking the actual nose here, or what are you doing there?
If it's just septoplasty means the correction of the wall between the 2 nostrils.
The wall,
the wall inside the nose. But if there is the external bones is accompanying this deviation, we have to break the nose bones. The nasal bones have to come together in the midline.
So you're realigning it and
realigning it,
almost reconstructing it.
Some patient has a very, very big breach, nasal breach, and when you remove the breach, we have an open roof. We need to close the open roof. That's why you have to break the nose, but inside. There is no external incision. We have inside incisions. You cannot see. And also during this operation, we have 4 or 5 things that help to improve breathing function and sinus drainage function. And generally, after surgery, patients have 2 or 3 days swelling and uncomfortable, not pain, but some uncomfort because of the swelling. After 1 week, we remove the splint and stitches, and people feel better. Generally, I say patients after 10 days, around 10 days, nobody understands you get a surgery with the nose. But you and your close relatives and friends understand you have surgery because you have some swelling.
Of course.
And around the 2 and 3 months, you can say that 80% of the swelling is gone. It changed within the first year, but 80% change within the first 2 or 3 months.
So because you have many international patients coming all around the globe to Ankara, how are you following them up? Like if someone has rhinoplasty, how many days do they have to stay here in Ankara?
Yes,
how do you follow them up?
Yes, the rhinoplasty patients, we want them to stay in the hospital 1 night, and after that stay in the hospital 6 days. And the 7th days, we need to see, remove spleens, remove stitches, show some massage. There's some certain massage very important. We have to see a patient in the first week because it's very important.
So 1 week is sufficient?
The 1 week. After 1 week, we can write this patient can fly to back to home. And after that, we have a special WhatsApp number for post-op follow-up. Nice. We have a special nurse for that. The nurse can write in every language. Some language she doesn't know, but she can use some AI to translate. Sure. And we need to follow up the patient in the first month, 3 months, 6 months, 1 year, or on WhatsApp. Sometimes if you need, we can make it one online
Zoom meeting
to see patients everything is okay, because they are far away. We have to make sure everything is okay.
This is great. So you're actually following these patients up to 1 year to make sure they have going back functionally, and you're available for them.
Yes.
This is amazing. And in terms of the third most frequent surgery, so you do blepharoplasty surgeries, rhinoplasties. What are the other top ones that international patients come to have done with you?
International patients, I guess most of them has post-bariatric surgeries. Which means the patient may have bariatric surgery.
Obesity, basically.
The patient may have bariatric. Bariatric surgery means this surgery related to decrease the size of the stomach, which is some different types. After this bariatric surgery, which has done by the general surgeons, we have a lot of general surgeons in Turkey, they do very nice. After losing weight, around 1 year after this surgery, they find the final weight, and they come to us for excess skin in the arm and the abdomen.
Get rid of the skins. Both in the arm as well?
The arm, breast, sometimes inner thighs, they have excess skin. This is the very common patients. Some patients, they lost weight without any bariatric surgery. They do just exercise and diet.
They need that.
They may also need. Some patients have a lot of pregnancy, many pregnancy, they may have some excess skin, maybe gain weight and lost weight. They have some problem with this unwanted weight in front of the belly, and they have some skin disease under the belly because in this hot weather. They need to remove this belly, and then we need to make abdominoplasty. We call it tummy tuck surgery with them. The men and women also need this kind of surgery. These post-bariatric skin excision surgeries is a third common general surgery operation, I guess.
Very important. So if you are going through a diet and lose significant weight, or if you went through a bariatric surgery, functionally you're happy, but physically or appearance-wise, those excessive skins can create problems. So you're able to take them nicely. And how long does it take to take these? Of course, it depends on the case, but these excessive skins and make them sure they have a good tummy tuck, they have a nice belly and things like that. And like if someone comes, how many days do they have to stay in Ankara?
It's similar. Generally, and for tummy tuck surgery, they have to stay in the hospital 1 night. Sometimes if patient overweight, need to stay 2 nights to make sure as breathing is okay, because this patient also has excessive abdominal wall. The abdominal wall has to be repaired. The rectus muscles, they're supposed to be
come
together. But since they eat too much, the intra-abdominal area is very big, and the muscles are separated, like some kind of hernia. We need to repair this hernia during this operation. That's why after this hernia repair, it's just like inside corset to decrease the breathing. That's why we make sure breathing is okay. And discharge patient, this patient has drain two drains, and the drains has to be removed around 5 days.
Mm-hmm.
Generally, around 7 days, if there is no problem, we can allow patients to fly. But if you see it is too much drainage, and we can wait more than it is, I can say that between the 7 to 10 days, we allow patients to fly back to their home.
And the full recovery of these takes how long usually?
Since the inside stitches, the rectus repair stitches is a little painful. That's why this patient has to help at home for 2 weeks at home. We don't want excessive exercise, excessive bulking. And after 1.5 months, they are allowed to do all workouts. 1.5 months, they need to rest, but they can do their job. They can go everywhere, but they have to be easy on their body.
I see. You also do very special types of surgeries. I know in Saudi Arabia especially, you had a large list of patients which are following you, making sure, in terms of many areas. But can you tell a little bit about your unique surgeries and cases you have done?
Yes, and this is some part of them is orthodontic surgery. Orthodontic surgery is related to the chin, upper and lower chin, shape deformities correction. These patients generally, some of them is because of congenital deformities, like cleft lip flap. Some of them without congenital deformities, there can be this primacy between the upper and lower jaw.
So either the lower jaw is longer or upper, on the front or back.
We need to bring these two chin together. In this type of surgeries, in the summer period or the midterm period, there is a vacation. This patient comes the vacation periods. We do a lot of these surgeries.
Beautiful.
We manage these patients with orthodontic doctors, which is dentist. The orthodonty, which means they align the teeth before our surgery. And once align the teeth, we see a real difference between the two chin. We can bring the chins together with inside mouth incisions and bony cuts. With special saws, micro saws. We cut and then they bring together and we make some plates, titanium plates to come together. And these surgeries sometimes become very complicated. For example, some patient may have a very, very narrow upper jaw and wide lower jaw. We need to expand the jaw and move forward or move backwards together. And we need to do, and if you want to do all of them in this one session, we need to have special orthodontists and a special surgeon can do this kind of surgery. We do the surgeries.
Through 3 surgeons together.
Generally one surgeon, but the help us, other surgeons is helping. And also I have some distraction bed. What is distraction? The bony distraction means, and if, for example, the lower chin is very big, around 20 millimeters, we can bring the lower chin forward within one session. But if we need more than 20 millimeters advancement in lower jaw, we have to cut the bone and fix external and internal fixator. But this fixator is special. And after 5 days, we need to activate the state. And every day, 1 millimeter advancement. For example, 30 days, 30 millimeter advancement of the lower jaw.
This is huge.
And they can change the whole life of the patient very, very dramatically. This kind of surgery is also very interesting.
Do they do the extension themselves, or you're
in the first few days I show them the patients, the children. I teach the parents, and because otherwise they don't need to stay in the hospital for 30 days.
That's amazing.
They go home and then in morning half centimeter, evening half centimeter, half millimeter activation, and every week come to me and then see chin's okay. For example, one side is needs more, I do stop here. Continue to the side, and the chins become together and finished.
This is a miracle. This is amazing, and we'll be showing also these pictures to our viewers, and it will be very interesting for them to see. I'm very curious about the principles you consider most important when you're doing an aesthetic surgery. What are your criteria? You're a very principled person, I know. That's why I'm asking. From your perspective, what are your principles most important while doing the aesthetic surgery?
It's very important to have a principle in this area because this field, since there's some kind of trade and they many people, unfortunately, doesn't have any principle. And in our perspective, it has to be aiming the normal, aiming the natural. And the natural is good if the patient has a natural face, nose or ear, and still asking something else because of the fashion or something. We need to say stop, because
Exactly.
some of them is affecting from the environment. Some of them has body dysmorphia disease, and we have to say stop.
The way they perceive their body is
yes.
wrong,
Yes,
actually.
yes.
And
Sometimes
they are obsessive about getting more surgeries done.
In the body dysmorphia, the patient may have very, very slight problem. They have a very big, they feel that it's a very big problem. They cannot eat, they cannot drink, they can just looking
Focus
mirror
on that.
all day. We need to see, and they have to say stop. The request supposed to be the normal request, and the request supposed to be okay. I want to be a normal. For example, it's even this pure cosmetic surgery has to be aiming to become normal.
Absolutely.
If it's still normal, we are aiming at another normal, and this patient is not going to be satisfied with the surgery. She will or he will seek
Keep
another
changing surgeons.
surgery. That's why the main principle has to be staying in a normal and how to say no if required.
That's the challenge. I mean, you're not money-driven person. I know you're very ethical, but for some, if patient is begging you to get surgery done, if you don't have the principles, then you will be just say okay for financial benefit, which none of my colleagues would be okay to that. But how do you convince, especially young girls? I think they just say, oh, I want to have this type of lip, I want this type of nose, things. They keep looking at social media, and in a way they are creating this body dysmorphia. How do you tackle that? Are you able to convince them?
If it's not pathological level of body dysmorphia, it's convincing them. Especially some patients, they're sticking too much because I get a lot of doctors and nobody they says something like that.
Yes.
They said, oh, you need this, you need this, you need this. And sometimes they ask me, what I need, can you say? I said, you need nothing. If nothing is disturbing you and is an objectively described problem is not exist in your face, I can't say anything to patients. Because this is the problem, the problem in patient had. That's why when I say no to patients stick it more. I need to come to you because this is the first time some patient coming and they offering to money to give that surgery, and you are saying no, they sticking and they trusting too much to you, and then they follow whatever you say. I say wait, and if you see this very objective problem, and if I say okay, you have this problem, etc., and then it's okay to do this, I can continue.
Well, thank you very much, Furkan Bey. It's an honor having you here. Let's finish this episode. I want to thank you again for your time.
Oh, you're welcome.
And we'll be continuing with other episodes with you.
You're welcome. It's a great pleasure to be your guest.
An honor. It's such an honor having you.
Hope to see you again.
Absolutely. Thank you very much.
You're welcome.
Ladies and gentlemen, this is one of the episodes we finished with Prof.Dr. Furkan Karabekmez, one of the top plastic surgeons in Turkey and globally trained in Turkey as well as United States. He gave us very important tips about what types of surgeries he is most seeing, and basically what types of patients take time to recover, and also the misutilization of these surgeries. So as an ethical person, you have listened to him. Keep staying with global health. This is your host, Dr. Yavuz. Take care and all the best. Bye.